I have this morning on the zone, I have Miss Efriye and Miss Abena Ichampo. Now they are, well, one is a physician's assistant and the other one is a sickle cell advocate. And this morning we're breaking down sickle cell, the conversation. Good morning.
Morning.
How are you?
I'm fine, thank you. How are you too?
I'm well, thank you. Tired, but I'm well. So let's jump straight into the conversation. So if I'm going to take a guess, I would say that physician's assistant?
No.
Oh, okay. Wrong guess. Okay. So you're the sickle cell advocate and physician's assistant.
Yes, please.
All right. I know that in the year 2024, everybody should know what sickle cell is. Everybody should know how an individual can get sickle cell. But unfortunately, that is not the case.
Yes.
There are so many people, in fact, even educated people who have not the slightest idea what it is, how a person gets it, and so on and so forth. So I'm very happy that we are having this conversation. I want to believe that first things first, let's break down the definition of what sickle cell actually is. Who's going to take that?
Okay, so thank you so much for the opportunity as well. I'll say sickle cell is a genetic blood disorder, and then this disorder affects the red blood cells, the shape and its functioning. So basically, in a normal individual, somebody who doesn't have sickle cell, the red blood cells are around and they are very flexible. They are able to move through the veins and do what they have to do. But in people with sickle cell, unfortunately, the cells are not round. They assume a sickling shape, and that they are not as flexible as the normal ones, which leads to problems and pain crisis here and there.
Right. Now, who can get sickle cell?
Okay, so sickle cell is hereditary. By hereditary, I mean that an individual gets it from his or her parents. So if you have a parent or there is a parent who carries the trait, the sickle cell trait, which means that the person is AS and is married to somebody who is also AS, there is a possibility that amongst the children that they will have some with sickle cell disease. Or if both parents are sickle cell, they have sickle cell, then their children will have sickle cell.
What if it's just one parent?
If it's just one parent, so it means that that person, whether a male or a female, carries the trait, the sickle cell trait. So then their children, one will get AS and the others might get AAAA, meaning they'll have the normal or they wouldn't have the sickle cell trait. So there might be one or two amongst their children who will be carriers, which we call the sickle cell traits. They'll just carry the gene and can also pass it on to the next generation of their children.
The next generation. All right. And so by this explanation, you would think that everybody should know their, what do you call it again?
Sickling status.
Sickling status,
Yes,
right?
yes.
Everybody has to know.
Yes, please.
Which, again, unfortunately is not the case. Because I'm sure if I called my producer right now and asked him, he will be telling me a story that I honestly do not want to hear. And he's not the only one. In fact, the entire team at the back, I don't think anybody knows theirs. So let's get into how a person can know their sickling status.
Okay, so there's a sickling test you can do.
Okay.
And with that one, it will just be it will show whether you are negative or you are positive. Good. And there's an advanced test that you can do that will show the actual thing that you carry, whether you are a carrier or you have the disease itself. So that's the electrophoresis. So with that one, when you do that test, you get to know, okay, I'm SS, I'm AS, I'm SC, I'm SF, and the likes. And then also there's this newborn screening. When you give birth, you can screen your children at that very young stage to get to know their status.
Right. So is it possible that, I mean, obviously, I think I know the answer to this question I'm about to ask already. for a person to grow so much, maybe all the way somebody in their 50s, 60s, who may not know their sickling status, but may obviously have passed on to children. Because I see that in your explanation, you said that if they have maybe 2 or 3 kids, there's a tendency that one of them or 2 of them may get it. But then sometimes maybe they just have 1 child, right?
Okay.
So maybe that child is the lucky one. And so there's really no telling what's going on because they only had that 1 child,
Exactly.
right?
Yes.
So when a person grows up all the way to my teacher is really old. He's old school. He's old. So all the way to the point where they are that old, and maybe they are done having kids. Do they still need to know?
Yes, I think they still need to know.
Okay.
Because
I mean, what would the point be of that? I mean, if somebody's, say, in their 50s, I don't know, maybe they're done having their kids. Kids obviously are fine or have been fine maybe in the last 20, 25 years. You don't assume anything could be wrong, right? So if there's a maybe 60-year-old listening to me or to us right now, they have kids, their kids are okay. What's the point in trying to check that now? Like, what good will that do for them?
So the thing is, we are trying to cut down the number of people that have sickle cell.
Right.
Yes, because if you check it, you get to know your status.
Mm.
You get to know your status. Your kids get to know their status too. So if there's anything for them, let's say marriage, for them to get married to, if they know their status, they'll know who to go in for. Let's say
helps.
you check, you are in 30, you are 30 years, you are 40, 60 and that. But then you have kids who are very young. They're also like 20s and they're 30s, ready to get married. I think they need to check that, able to know what they are going in for.
Right.
So that you can have a better understanding of yourself and how you can handle the disease.
Right.
Yes.
Okay. And these checks usually are done, like you rightly said, when people are about to get married, when the both partners.
That's one thing I think is not fine. You don't wait till you want to get married before you check.
But that is what happens.
Currently, we get people trooping in currently at my station. We get people trooping in requesting to do the sickling test.
Individuals or couples?
Individuals. And
Okay.
I think some of the companies, organizations, when they are employing, they have a form that contains the laboratory investigations they want their employees to do. And I've seen a couple of them that sickle cell is part. So I think we are getting abreast with things, but we need to do more because
Right.
it's one of the tests, like the few tests that when you test and it's negative or you are AA, meaning you don't have the sickling trait or the disease, it doesn't change. That is what you have forever throughout your lifetime. So if I've done the test, I am AA, and maybe I go somewhere and they ask me, I can be bold enough to tell them I did it and I'm AA. If they want to cross-check, they cross-check and they'll get the same thing. So I
Right.
believe whether you are young or old, you should know that that would also help you, whether you're a carrier or you have the disease, to know what to do to stay healthy and also to live long. So it's very, very necessary to know.
It's very necessary. And people shouldn't wait till they're about to get married.
Please, they
not at
shouldn't.
all.
Okay, now let's cross over to, yes, I didn't check. I got married. I had a couple of babies, and now they are sick. What then?
Okay, so as Efriye Riley said, during the we have prenatal tests and then or prenatal screenings, and then sickle cell testing is one of the labs that they do. So in case you didn't test from infancy, adolescents who you didn't also test whilst you were getting married, the woman or the female who is pregnant, during the time she's going for the antenatal clinic, will get the opportunity to do that test in case she's positive and doesn't even know the status of the spouse, because sometimes it's hard to get the men to come to the hospital.
Did you say sometimes?
Yes, I said sometimes.
Why are you being modest with your words?
Because some men come, but it's difficult to get,
Right.
I would say, majority of them.
Exactly. That's what I was hoping to hear. All right, so let's move on.
Yeah, so it's difficult to get majority of them to come. So if you are SS, I'm sure throughout your life before you get married, you'll be getting the crisis and all that. There'll be things that will make you know. But with those who are careers, mostly some people don't see anything. They don't get any crisis. There is no body change or nothing that would even prompt them to go for the test. But with a prenatal test, when that is done and then we pick it up that you are AS, when you give birth to your child, the early childhood testings, we have to do it for the child to know whether he or she is also a carrier or the person has sickle cell disease. Then we can psych both parents on how to take care of the child, what it comes with and all that.
Right, but isn't that a test that every baby should have?
Yes.
So that's a newborn screening
Yeah.
that I earlier said.
Okay.
Yes.
So every baby that's born in Ghana goes through that.
Oh, I don't know for previous times, but I'm sure right now we do that, especially when both parents carry the trait. If I'm AA or if
No, not about that. I mean, I'm pregnant. I'm going to have a baby. Will my baby get the test? They shouldn't know whether I'm a carrier or not. Will every child that is born get tested?
I can't really say that.
You
for
can't
a
tell.
fact.
Okay.
But
Okay.
what I would say is that, as I said initially, if the mother is a carrier of the trait, if it's the mother is AS, and we don't even know what the father has. When the mother puts to bed, we would test the child and see. Maybe the father too is AS, and it's likely the child will be SS.
Okay. All right. So if you check and maybe this child has, the sickling gene
disease.
or the disease,
Okay.
what next?
Okay, so the child is in the system already. The child is in the world.
Mm.
So we just have to psych her parents or his parents.
Okay.
Let them know. Probably they just carry the gene, so they don't know the pain crisis. They don't know the.
So you take them
jaundice and
through what, counseling?
explain to them
Okay.
what they should expect. Maybe the child will take long to develop as compared to other children who don't have the sickle cell disease. So we will let them understand all that so that it wouldn't traumatize them. They
Right.
wouldn't think that maybe, as they say in Chi or in Swoba or something like that. Because people don't really understand. And they might think, Wawun Swoba, or it's a cursed baby or that. So we take them
Right.
through that counseling and explain it to them thoroughly for them to understand and know what to expect in the near future.
And to do when the crisis
Yes,
comes.
please.
Also, I think one of the things that I've heard, even before I got any education on sickle cell, was that anyone who has sickle cell doesn't live long.
That's
That is
not true.
It's a myth.
It's a
That's not
myth,
true.
but you've heard that
Yes, I've heard a number of
a
times.
number of
It's a myth.
times.
Yes.
So
Yes.
just to cancel that myth, I've seen an elderly man, 90 years, and he was coming for his routine medication.
Okay.
He's a sickle cell disease patient. He was
Yeah.
coming. So if you take good care of yourself, do what you are told to do, you live for long.
I know that. In fact, we have quite a number of people, in the industry who have sickle cell. They talk about it all the time, and they're doing pretty
They're
well.
doing fine.
Yeah, KSM
Yeah.
has sickle cell. I mean, he talks about it all the time, and obviously you see how old he is.
Very, very
So I can understand, but it won't come without the challenges,
Yeah,
right?
yeah.
It will definitely not come without the challenges.
It's like you are battling every day with it. It's a daily battle. It's not just the pain.
Yeah.
It's not just the pain. You have to
Right.
go through it.
But with the right, handling of it and knowing what to do, you'll be able to sail through.
Yes,
You
please.
will.
Okay, so where do we go from here? What is your plan to educate more people on sickle cell disease?
Okay, so I just started my advocacy, and I'm trying to work on. I have a social media platform where I educate people.
Okay.
And I also love to partner with schools and then do more education. And I do volunteer jobs for some NGOs too as well.
Okay.
We are dealing with the sickle cell.
Okay.
So from time to time, we organize talks, educational talks, and we do a lot of that. So basically, that's what I'm trying to do now. I'm
Okay.
just starting.
Right. So what's the social media handle if people want to reach out?
Sickle Advocate on Instagram.
On Instagram, Sickle
yes.
Advocate.
Yes, please.
Okay, so people can reach out to
Yes,
you.
they can reach out.
They,
to
they
me.
have trouble understanding anything?
Yes.
Okay.
Okay, and just to add up to what Efriye said, we will be, myself and I'll be hosting her on Friday on Facebook at exactly 6 p.m.
Okay.
Just have a talk on sickle cell. It the education will come in here and there, but the main idea behind the Fridays program is to ask her what she goes through on a daily basis, how it has been, her journey from childbirth till now, just to enlighten people. Maybe you have a child or you have somebody, you don't even know if the person has the disease or not, but the person goes through a similar thing. Maybe when you hear her story, you'll be able to relate.
Right, that is
or
a freest
add-
story.
Yes,
Yes,
please
please.
add
Right,
the dots
okay.
and then take him or her to the nearest hospital for the
Right.
test to be done.
Right. So,
So
what
we
we're
just-
saying is that Ifria,
I'm a
you
warrior myself. I'm a warrior.
okay, that's wonderful. And oh, that should have begun the conversation. And I mean, at what point did you know this?
So early primary, way back school, primary.
Okay.
I realized I was doing things differently. Like my mommy would put paracetamol in my bag, raincoat, telling you not to go through the rain, and I got to know my early stages in primary school. So that was when I
Right.
got to know.
But were you getting sick?
Yes, frequently.
Okay. What kind of sickness? Like not dayna. What were you going through? Like
You just wake up and you have pains at your joints, your bones, headache. You're normally tired. Yes, swollen feet and swollen arms. So you have to rush you to the hospital
okay.
and all of that.
Right. And that has been something that's you know you've had to go through your whole life.
Yes, I mean,
Does it get better at some point, or is it seasonal? Is it something that brings it on in particular? Is there a way you can protect yourself to make it less agonizing? Like, how does it work?
okay, so there are triggers.
Right.
Like when you have this cold weather, you're not supposed to bath cold water. It's supposed to be hot water. You don't follow it, you can get a crisis.
Right.
And then you're not eating too well, you stress yourself, you can end up in crisis. And there are times you are doing everything. You are taking your folic acid, your zinc of it, you are doing just fine, then you wake up and then the sickle cell says that I'm here.
Right.
So you're just trying to live with it and all of that.
And all of that.
Yes,
So
please.
usually when it says I'm here, what
So
exactly do you
if-
feel?
Your chest, you have chest pain.
Okay.
You can have joint pain, bone pain. You're just not fine. You're not
Right.
yourself. So you can do a first aid. Maybe you just take your medicine, let's say paracetamol, and you're still not fine. It's advisable you visit any hospital close to you. And then when you get there, let them know you have sickle cell before they administer any drug or something.
Right.
But Kolebu does this thing, there's sickle cell clinic at Kolebu. So every 3 months you can go. But as and when if you are not okay, you can just walk into Kolebu and then they'll check you. They'll
Right.
treat
So
you.
when you're feeling that way, usually when you go to the hospital, what do they do for you?
When it's that bad, when you're in crisis that bad, they get you pain medication
Okay.
or injection and then give you some IVs depending on the issue you went with. So when they do that, you be on admission, but then when it's exactly 2:00, they're closed. So when it's around 2 and you're still not fine, then they just refer you to a nearby hospital where they can do it well for you. Because Kolebu's own, it's not like they are always there. It's from
Okay.
8 to 2. That's sickle cell clinic.
Right.
Good.
But you can't go to any regular clinic or any regular hospital.
You can go to any
You
regular
can go
hospital.
anywhere.
Yes. Once
Right.
you're not fine, you can go anywhere.
You can go anywhere.
But let them know this is you. You have sickle cell and they'll know how
Right.
best to treat you.
Okay. And the pain meds they give you, is it that it's in higher doses, or how is it
depends.
effective in the hospital and maybe not at home?
Oh, it's very effective in the hospital. Very effective in the hospital.
Okay.
So it depends on the pain. So they'll ask you on a scale of 1 to 10, how do you feel? So if it's like 6, 7, they know what they'll do. If it's like 4, 5,
Okay.
they know what to do.
Okay. That's very interesting. I'm really proud of you. I mean, having
thank
come
you.
all this way, it's like me, Charlie, I would call my boss every morning and say, today I'm not coming to work. I'm sorry. I can't come. And obviously, because I mean, when you join a company and you have these types of issues, they can't fire you. So me, I will use that to my greatest benefit. Anyway, that was just a joke. But I really am proud of you. I'm really proud of you, and I really hope that you're able to reach out to more people, and we see the way forward. Obviously, your mom and dad didn't do the check. How many are you?
We are 3.
And you're the only
I'm
one.
the only one, yes.
So your sis,
Yeah,
brothers,
my brothers,
your
two
brothers, they're
yes,
fine.
They're fine.
But you are not, unfortunately. But that's okay. So you can do more education so that a lot more parents know and understand and see reason why they should, know their statuses to avoid
All of this.
I can imagine all the money you have had to spend going to the hospital your entire life. I'm really sorry about that. Yeah, because hospitals are not, and these days there are very nice hospitals. I was gonna say that hospitals are not nice, but these days there are very, very nice places. Like I've been to places and I'm like, wow, can I sleep here tonight? It's like I've been to places where people are putting in the effort, and a long time ago, when you enter, the minute you walk through a hospital, you feel it. It's in the smell that comes with it, and then the faces of the nurses as you walk in and all of that. But these days, it's so different. There's so many places you can go and you would wonder like, oh, wow,
Hospital.
this,
Yeah, that's true.
So, yes, I was going to say hospitals are not nice, but these days they are. But my heart goes out to you, and I wish you the very best. And we're here to support you however we can. All you have to do is to reach out to us. My producer is here for you 24/7. Call him
Thank
anytime.
you so much. And the month of September is Sickle Cell Awareness Month.
Okay.
So I'll speak to my partner, my friend, my sister. If maybe after what we'll do on Friday, maybe we can pass through again for maybe a short time.
Hey, when you say short time, I'm sorry, but it means a lot of things.
Okay, we can pass through again
Given the
for
opportunity to be
here again for maybe an educational
Don't mind
session.
me. Don't mind me. Don't mind me at
We
all.
are still on the advocacy,
Yes,
so they can
yes,
follow our social
absolutely.
media handles.
Absolutely.
There are videos, short videos to educate, flyers that we'll be putting up as well in the simplest form that we wouldn't be including the medical terms and all that anybody
That's
who
wonderful.
reads would understand what exactly it is and
That's
how
wonderful.
to avoid it or
That's
how
wonderful.
to
Great job, you
Thank
guys.
you.
Wonderful. You're not selfish with, your knowledge at all. You want to share. You want to reach out. You want people to know, and that is wonderful.
Thank you.
God bless you richly. However, we
God
can
bless
help.
you
We are
too.
always here, okay, to
Thank
support you.
you.
Thank you for coming
Thank
through.
you.
Thank you for
too.
having us.
Okay. All right, so there you have it. The conversation on sickle cell is very, very important. And we're going to have more of it. This is The Zone. This is Star 103.5 FM. We're going to touch him on. Yeah? All right. Do stay tuned.